But after a conventional treatment, either surgery, high-dose radiation, chemotherapy, when you finish the treatment, I don't think you will look as good as you look now.
I actually have a friend who got diagnosed on prostate cancer while I was here. I told him about this place and told him, you know, I'm very, very encouraged by my PSA is going down fast. I feel great. He went with the surgery. He decided that he was going to go with the surgery. He felt more comfortable doing that. It was quicker. He didn't have to, you know, give the commitment every day here. He could go in, be out in 2 days in the hospital, and it was done. Since that's happened, he's now dealing with the side effects, and he's not happy. And because we did it at the same time, he can see that I'm fine and I feel fine and my energy level's good, and I'm really glad that I made this choice, whereas right now he's not so glad because he says he's got a long road ahead of dealing with how his body changed.
Yes, his body changed.
And right now, to be honest with you, I feel bad for him, but I told him about this place.
Well, I'm very happy that you decide to be one of the few crazy ones that decide to do something different.
Well, you know, I'll say it again, the videos on the website made a difference because when I was checking, when I was checking, I read a lot of those websites. And you don't really, you understand the human part of it when you're reading. And when you get to see somebody talking about their experience, that sold me. And I'm in advertising. And I know how to sell people. And the way to sell people is with a human connection.
So then I have a question for you.
Okay.
Because if you're in advertisement, could you see that was a genuine video, that it wasn't an actor behind the camera?
Absolutely.
All right.
Absolutely. In fact, I like that it was very amateur and rough looking. It wasn't polished because I believed the person talking because it wasn't in a set. It wasn't trying to make it as pretty. I was listening to what he was saying more than looking at what it was all about. So of course I believed it, no problem.
When we move to Beverly Hills, I'm gonna do it more professional.
No, don't. You should do it just like this because it looks real.
All right, Mike, thank you so much. One more question. It was a long journey. 5 months is a long time. But what does your wife think?
She saw me going through all the journey of finding out about what this prostate cancer does to you, what your choices are. Right before this started, my wife's brother died of cancer. So this was a bad time for me to find out I had cancer. We just lost him. In fact, the day he died was the day I found out I had cancer. Was the day I got the call. She, after seeing all the kinds of treatment you can get, was confused, listening to people who didn't know about alternate treatments, people that trust doctors no matter what they tell you, instead of trying to find it out for yourself. After a while, she just realized that together, if we both felt good about it, once we came down here, we had to have a consultation, and I met with Dr. Wolstein. After talking to him, I felt 100% confident. I knew this was what I was going to do, and I was going to hope it was going to work. I had seen things where it did work, but for the most part, she just felt relieved that we found a place that we could actually go to that offered something that wasn't surgery.
So, but I can tell that you are kind of lucky that your wife supports you all through.
All the time. Yeah. In fact, to be honest with you, I think that helps for the most part because, let's face it, you're driving to Los Angeles back and forth. So between the drive and the actual treatment that I do, I would leave my house at 7 o'clock and maybe get home about 2. So that's pretty much an all-day type of thing. Because she's there to support me, it makes the drive all worth it. It really does, because every time I get those PSA tests, you know, it's like a report card, and you did really well on it, you know, and that was what we looked forward to, like every 2 or 3 weeks, just to see what those were all about. So yeah, without the support, it's tough doing it by yourself.
Do you have kids?
No kids. We decided not to have kids. We got careers, unfortunately.
Are you coming back to work?
I start Monday.
Oh, congratulations.
I start Monday. So, and they're excited to have me. I've worked there 11 years, and when I started this treatment, the owner of the company had gone through breast cancer. And she said, don't worry, your job will be waiting for you.
That's good.
That makes a huge difference.
Of
Again,
course.
lowering that stress
Yeah.
level makes you heal faster. So
That's fantastic. Well, I'm very happy for you, Mike, and thank you so much for
Oh, sure.
talking to us.
Sure, glad to do it.
All right.
Glad.